It is 7:13 and it is National Nurses Week, and we are continuing to celebrate the hard work that they do in and day out. Monica Robbins has a look at the special program the Cleveland Clinic has to support nurses' well-being.
Yeah, nursing is a stressful job and can take a toll on mental health. So the Cleveland Clinic got creative to find ways to help their staff. Shannon Pengel is the Vice President and Chief Nursing Officer at Cleveland Clinic and is joining us, as well as Michael Curry, who is bringing Walker with us. You are Walker's handler. Thank you so much for being here.
Yeah, thank you for having us.
All right, Shannon, I'm going to start with you. Let's talk about burnout with nursing. How big of a problem is this right now? Because we hear about it all the time.
Yeah, it truly is a problem that is impacting healthcare. Really, it's always been an issue, but it's been heightened as we went through the pandemic. We saw high rates of turnover, high rates of early retirements, and just working in healthcare, as everyone knows, is very stressful. So really having programs designed to combat that resilience is really something that the Cleveland Clinic has focused on. Paws for Caregivers is one example of that program where we brought a facility dog in specifically to round on our caregivers on a daily basis.
So I completely believe that dogs are therapists. Yes. Because I've used one for my entire life. Michael, tell me about how this works.
So I will sit in on the nursing huddle every morning, find out what has happened throughout the campus on the previous 24 hours. I'll identify some areas of need, and Walker and I will start to go around on the staff.
So what's been the response from nurses when they see Walker coming down the hall?
Yeah, big smiles all the time. I'll let Shannon talk to that. She's identified some things with our critical care nurses and their responses.
Yeah, Walker likes to visit our critical care areas and our emergency department frequently. And for those that have worked in healthcare, you know critical care and ED can be some of the toughest areas to work in as a nurse. But when Walker comes in the unit, all of a sudden nurses are kneeling on the floor, talking in those doggy voices. Oh, hi, Walker, we're so happy to have you. So it's just amazing to see that moment of joy that our caregivers get to experience in the midst of the critical care they're providing.
You know, a lot of people are going to say, oh, it's great to see a dog, it's great to pet, a dog, but is there science behind this?
Yes, we actually are in the midst of a research study right now looking at the response that Walker is able to provide to our caregivers. But we know from many studies before this that increasing caregiver resilience will ultimately impact patient outcomes and safety in the workplace.
So they don't need very long to be with. So give me an idea, like how long is Walker's therapy?
You know, when Walker goes into a unit, he may spend 45 seconds to a full minute with a caregiver, just enough for them to decompress for a brief minute. In other cases, he may go into a unit and spend 10 minutes with a care team that maybe has experienced a traumatic event, the loss of a patient, just to give them time to pull away from the critical care they're providing and take a moment for themselves.
Michael, do you get the call that, hey, we have a stress situation on floor whatever, and we need Walker?
I do. I get calls and texts almost every day. There may have been the loss of a long-term patient. We've actually gone and supported teams when we've lost a caregiver unexpectedly as well.
How busy is Walker?
Well, last year he completed 1,995 visits. So we're on maybe 10, 12 units a day, sometimes a little bit, sometimes more.
Is this something that it's not just Cleveland Clinic based, but is this something that should be, in your opinion, across the country at every medical facility?
Absolutely. Every hospital should consider having some type of facility dog specifically for caregivers. You can also follow Walker on his Instagram page at Paws for Caregivers, and you can see all the different units he goes to, all the different caregivers he interacts with, and enjoy his activities.
If he's that busy, I think you need a couple more Walkers.
Yes, we do. We definitely do. We are always looking for opportunity to expand this program. Walker is the only facility dog at our Cleveland Clinic hospitals here in Northeast Ohio. We obviously would love to expand that.
All right, and is it something that people can get involved with, you know, from a volunteer aspect? Because I know there's a lot of therapy dogs, but this is a little different.
Correct. This walker has been trained specifically in the emotional support of caregivers. I don't know if you want to talk about your training, but Michael got to go down to Atlanta to pick up Walker.
Yeah, Walker comes to us from an organization called Canine Assistance that's located in Atlanta. He was swaddled into a hospital when he was 8 weeks old and continued his training for 18 months, at which time I went to Atlanta and I was paired with him. Talking about the program and needing more dogs, Walker is supported through philanthropic donations, and it takes about $100,000 a year to support a dog.
Wow.
So if anybody's interested in that kind of philanthropy, we'd welcome that.
So this is pretty much like med school. We'll just leave it there.
Yeah,
All right.
exactly.
Thank you so much, and thank you for sharing what you're doing to help all of us as patients.
Absolutely. Thank you so much.
All right, back to you.